Hello everyone and welcome in our channel. Today we discuss the diseases due to deficiency of vitamin D. Before discussing about the diseases due to deficiency of vitamin D, we discuss the some properties of vitamin D also. As you know, it is a fat soluble vitamin. Its chemical name is calciferol. It exists in two forms, vitamin D3 and vitamin D2, calciferol, cholecalciferol and ergocalciferol. Vitamin D plays an important role in building and maintaining our skeletal system. It also very important for good bone and teeth health. It plays it also helps in mobilization of calcium and phosphorus in our bone. Vitamin D regulates the concentration of calcium in blood plasma. It also helps in maintaining blood calcium levels. Now we discuss the deficiency of vitamin D. Deficiency of vitamin D is relatively less common because this vitamin can be synthesized in our body. About 90% of the total requirement of vitamin D in our body can be synthesized in our body when we come in contact with the sunlight. This vitamin D can be synthesized in our skin. It discussed in the previous video also. So, the disease due to deficiency of vitamin D is less. Long-term vitamin D deficiency leads to bone softening known as rickets in children and osteomalacia in the adults. Minor forms of disease leading to impairment of bone growth in children and demineralization in adults, especially in the old people. बच्चों में बोन ग्रोथ में कमी आ जाती है विटामिन डी की कमी से और ओल्ड पीपल्स जो होते हैं उनके बोन्स में डिमिनरलाइजेशन होने लगता है जिससे उनकी बोन्स वीक होने लगती है. Long-term vitamin D deficiency leads to bone softening known as rickets in children and osteomalacia in the adults. Insufficient vitamin D can also contribute to osteoporosis, a loss in bone density that results in the brittle bone. Brittle bone, what is brittle bone? What is the brittle diseases? ब्रिटल बोन्स में हमारी बोन्स जो हैं वो हार्ड तो होती हैं लेकिन टूट जल्दी जाती हैं. जैसे कि सूखी लकड़ी होती तो हार्ड है लेकिन वो जल्दी ही टूट जाती है, बेंड करने पर ही टूट जाती है. सेम अगर हमारी बोन्स में कैल्शियम की कमी हो जाती है, विटामिन डी की कमी हो जाती है तो हमारी बोन्स भी टूटने के चांसेस ज़्यादा हो जाते हैं. इस डिजीज़ को ब्रिटल डिजीज़ कहते हैं. विटामिन डी प्लेज एन इम्पॉर्टेंट रोल इन प्रिवेंटिंग एंड ट्रीटमेंट फॉर मेनी अदर हेल्थ कंडीशन इंक्लूडिंग कैंसर, cardiovascular disease, type 2 diabetes, depression and many other problems occur due to the deficiency of vitamin D in our body. Rickets मोस्टली जो होता है 1 से 3 साल तक के बच्चों में ये रिकेट्स प्रॉब्लम्स ज़्यादा देखी जाती है. Renal diseases are also caused due to the deficiency of vitamin D. Osteomalacia and other bone disorders arises in patients with chronic renal failure. Impaired formation of 125 dihydroxyvitamin D3 in kidney may be responsible for it. Liver diseases. Osteomalacia is sometimes found in patients with cirrhosis of liver due to failure to form 25 dihydroxyvitamin D3. Osteomalacia, it is a classical disease of multiparosomia. The common features are pain and muscular weakness. In case of osteomalacia, pain ranges from dull to the severe pain. The sides of our body parts which were frequently affected are ribs, sacrum, lower lumbar vertebrae, pelvis and legs. These are the some parts of body which are affected by the osteomalacia disease. Muscular weakness is often occur and patient may find difficulty in climbing stairs or getting out of the chair. These are some problems due to the deficiency of vitamin D in our body. One of the most serious disorder associated with vitamin D deficiency is hypocalcemia tetani, which is caused by insufficient supplies of calcium to nerves and muscles. जब हमारी नर्व्स और मसल्स को कैल्शियम की सफिशिएंट सप्लाई नहीं हो पाती है तो हमारे बॉडी में हाइपोकैल्सीमिया टेटानी नामक डिजीज हो जाती है. These are just some problems or you can say some diseases due to the deficiency of vitamin D. So, vitamin D is very necessary for our body. Now we comes on the sources of vitamin D. Only few foods are good sources of vitamin D. and major part of about 90% of the total requirement of our body can be synthesized in our body when we come in contact with the sunlight by a process. Some marine fishes are good sources of vitamin D also. Egg yolk, butter and milk are the some source of vitamin D also. So the only few foods are good source of vitamin D. These are the some sources of vitamin D. विटामिन डी का सोर्सेज बहुत कम है. ये हमें एग योग बटर मिल्क आदि से मिलता है. मैक्सिमम विटामिन डी हमको सनलाइट से सिंथेसाइज होता है, उसी से मिल जाता है. तो दीज आर दी सम सोर्सेज सम डिजीजेज ऑफ द विटामिन डी. नाउ आरडी ऑफ द विटामिन डी. चिल्ड्रंस के लिए 400 माइक्रोग्राम एंड एडल्ट्स के लिए 200 माइक्रोग्राम्स विटामिन डी की रिक्वायरमेंट होती है. सो दीज आर दी some problems, some diseases due to the deficiency of vitamin D in our body. And we discuss here some properties of vitamin D, deficiency of vitamin D, and the sources of vitamin D. The main diseases अगर हम पॉइंट वाइज गिनते हैं तो रिकेट्स, ऑस्टोमलेशिया, ऑस्टोपोरोसिस, ब्रिटल डिजीज, लीवर डिजीज, रीनल डिजीज, hypocalcemia tetani. These are the some diseases which caused due to the deficiency of vitamin D. Thanks for watching this video.